The days leading up to your surgery are crucial in setting the stage for your recovery. We understand that surgery can be anxiety-provoking, and we are sensitive to what you're going through. While this may be your first hip or knee replacement, rest assured this is a routine procedure for us, and we perform it regularly. You will be surrounded and cared for by a skilled team of clinicians who excel at what they do. First, let's talk about optimizing your body for surgery. Sleep is important. Your body needs appropriate rest on the day of surgery. I realize it is difficult, but try to ease your mind and get some good sleep on the days leading up to your operation. Second is nutrition. In the weeks leading up to your surgery, make sure you maintain a high-protein diet. This could be done via generalized nutrition or a nutritional supplement. A low-carbohydrate, high-protein diet provides the appropriate building blocks needed to help you recover. We have resources like the Accelerate XR nutritional supplement to help you achieve this. Just ask and we'll steer you in the right direction. Many of our patients will meal prep the days before surgery, preparing some of their favorite meals that can be easily taken out of the fridge or freezer, cooked or heated as necessary. Next is environment. It's important that you optimize your physical environment to meet your post-surgical needs. This might involve arranging your space or enlisting the help of your friends or family prior to surgery. You will be provided a walker. Spend some time practicing with it so you are familiar with its use when you get home. Remove any obstacles, cords, or throw rugs to minimize the fall risk. Consider how you will care for your pets. It may be challenging for the first few weeks or so after surgery. Two things we highly recommend you obtain prior to your surgery. Number one is an ice machine, or at least some way to keep your knee or hip cold after surgery. Decreasing the temperature of the surgical area significantly decreases inflammation and improves pain or swelling. You can utilize bags of ice, frozen peas or corn, or obtain an ice machine at our office. If you opt for an ice machine, be sure to get one with ice and compression. Second is a wedge pillow, something to elevate the legs above the level of your heart during your recovery so that swelling can be reduced. For knee replacement patients, I recommend a ROMTech. This is a specialized exercise bike designed for knee replacement recovery and can help improve the range of motion. This is a standard part of my post-surgical routine, and it should be obtained insurance permitting. By following these guidelines, you will be well prepared for your surgery and have set the stage for a smooth recovery. If you have any questions or need further assistance, please don't hesitate to ask.